Welcome back, everyone, to the Empowered Patient Podcast. I have a real wonderful guest for you today. Dr. Towsen is an orthopedic surgeon, and she is also a ballroom dancer. And she's going to tell us all about that. We're going to have a wonderful conversation about her pathway to where she is now, as well as how we feel that it is changing healthcare in general. So, without further ado, how are you today?
I'm doing great, thanks. Thanks for having me on.
Absolutely. I forgot to ask you, should we go first name or second name?
Oh, first name,
Oh, first name. Okay. So
please.
I'm Tiffany.
Yes, Adrienne all the way, please.
Adrienne. All right. So, Adrienne, tell me a little bit about you. Where are you?
Yeah, sure. So I'm located in Westchester, Pennsylvania, so not too far from Philadelphia. I grew up in New Jersey, but I've been in Pennsylvania for most of my adult life. I went to college not far from where I live now, and then went to med school in Philly, did my residency out in Pittsburgh. So I was out in that the other side of the state for a while, and then I came back and did my fellowship at Jefferson in Philly.
Oh,
And
wow.
I've worked in this area, in this community outside of Philly for the past 21 years.
Wow.
Yeah.
Wow. That's quite a road, but you stay pretty much local, right?
Yeah.
Yeah, I did too.
Yeah.
I grew up on Long Island. I went
Okay.
to Cornell Medical in the city,
Yeah.
residency, New York Hospital,
Yeah.
Sloan, whatever, and actually, I went to Princeton, New Jersey. That was about as far as I went. Now I'm back on Long Island again.
Yeah. Yeah.
So, yeah, someday I might venture out elsewhere, but we'll see.
Yeah.
So tell me a little bit about your pathway. You're an orthopedic surgeon and you're
Mhm.
a woman in a
Yep.
predominantly man-powered
Very much.
specialty. Tell me all about it.
Yeah, sure. So I came into orthopedics the way a lot of us do, which was basically like sports injury related. So I
Mm,
think, it certainly is very male dominated, and you do certainly get the stereotype of like the ex jock, who becomes the orthopedic surgeon and probably has some kind of sports background. I mean, not everyone, but a lot of people do.
Yeah,
And
sure.
sometimes it's also like a sports injury that kind of gets you interested in it. And that was really my path. When I
Mhm,
went to college, I was pretty sure that I wanted to be a physician. That was my goal. I was
mhm,
didn't really have a pre-med major where I went, but I was basically headed down that road. And then
right.
I played lacrosse. So I played lacrosse from like when I was in middle school and, through college. And then I had a knee injury that needed surgery when I was in college. And so
Mhm.
the typical like, ACL meniscus surgery. So I had that when I was a sophomore in college. And
Mm.
the
Oh, yeah, sophomore in college.
sophomore,
I
yeah,
thought you said high school. I'm like, wow, that's early.
no, sophomore in college. And then, so I had surgery, and the surgeon who did my procedure was actually, he had gone to the same college that I did before. And then that's how he kind of ultimately ended up being like the team physician there. And he kind of took me under his wing, and
Mhm,
he became a mentor for me, and going through the whole experience of my own surgery and rehab, and then getting
sure,
back to playing, and really enjoying that, like, that kind of backwards look at it, I guess. I mean,
sure.
looking at it now, I could say enjoying it. Then I wasn't really enjoying it. I was devastated to miss a season of lacrosse and
Right.
all of that. But it really did show
You
me
got back?
what's that. Yeah. So I played, the next 2 years, and then I
Oh,
played on.
lucky you. I never made it back. I was
Yeah.
a little older than you.
Yeah.
When I did my ACL, I tore my ACL my beginning of my junior year in college,
Oh, okay.
and I couldn't get back.
Yeah.
They lock you at 20 degrees.
Yeah.
And then I had, like, a frozen knee, and then I had to have more surgery just to break open the scar tissue that they had
Yeah.
formed. So I never made it back,
Yeah.
unfortunately.
Yeah.
Glad you did.
Yeah, no, I did. And so, definitely that whole process made me very interested in orthopedics. And then, like I said, my surgeon became a mentor for me. So
Mhm.
I actually did take a gap year between college and med school. And I worked, because I was also working in the training room some at my college. And I was a
Uh-huh.
little bit, interested. I was very interested in the rehab process too.
Sure.
But then I worked, kind of shadowed the surgeon that did my procedure, and was able to be in the office, was able to go to the OR sporadically. And I
Wow,
was like,
that's
yeah,
nice.
this is definitely what I want to do. And so
Yeah.
he became like he was a very strong force in that for me. Yeah, so I did my third, med school was Philly, but my med
Right.
school also had an affiliation with Allegheny General Hospital out in Pittsburgh. And so I
Mm,
ended up doing my clinical rotations out there,
right.
and then got to really get to know the orthopedic guys out there, did a little bit of research. And although, I did I mean, we're over 20 years now, 26, 7 years ago. It was still a male dominated field. It was, much even more so than the statistics
Sure.
changed a little bit, in that time frame. But the guys were great and very like accepting of me and my interest in orthopedics. So I did some research and got in kind of with the orthopedic guys there and ended up matching there for my residency.
Oh, that's great.
Yeah, so I was in Pittsburgh for my residency, and the only woman, the first woman. But like I said, I had
Ah,
yeah, had a really supportive group around me. It was a relatively small program. There was just 2 of us a year.
oh, wow.
Very close to the guy that was my co-resident my year, but all the guys
Mhm.
were great. And it was a busy time because I ended up having 2 children during that time as well. So yeah,
During residency or afterwards?
during
During residency.
yeah.
Nice. Okay.
So yeah, it was a little bit crazy. Also, as the first and only woman, then ultimately having 2 pregnancies during the 5 years.
Wow.
So yeah, so
Oh,
it was
yeah,
a
I
lot.
forgot that's 5 years. Wow.
Yeah,
Did you do a fellowship also after that?
I did. Yeah, so felt excuse me, my residency in Pittsburgh, and then my fellowship. So I did, 5 years of orthopedic residency, and then I did a sports medicine, which is mostly shoulder and knee surgery fellowship at Jefferson back in Philly. Yeah.
Wow.
So, but yeah, so
Wow.
it was really the sports angle,
God,
and
such a long road. Doesn't it it takes too long to become a doctor, you know?
it does.
It's
Yeah.
crazy.
Hmm.
So, I mean, how old were you when you were done with all this? Honestly.
Uh, what would I have been? 33? I get 32,
Yeah,
32, 33.
probably. Trying to
Yeah.
think when I finished.
Hmm.
I see. Yeah, I mean, I was
Yeah. Yeah.
pushing 30 myself when
Yeah,
I was
32,
done.
I guess, because I guess I took that like gap year, but then
Right.
my second daughter was born when I was a fifth year resident. She was born when I was 31. So then by the time I was done with fellowship, yeah, I would have been 32, I guess. Yeah.
Right?
So yeah.
Best years of our lives.
Yeah. You
Training.
yeah, exactly. Definitely have a different young adulthood than many other people.
Absolutely.
Yeah.
So, and then I understand you've made some pivots lately. So you were in private practice or you were in an academic practice?
Yeah, I was in private practice. So
Mm,
I've been in private practice for the past 19 years. I had one
wow.
job right out of fellowship. I took a hospital employed job for 2 years. So at that time, I had 2 young children. They were 1 and 3. And I actually just had gone through a divorce as well. So it was a very crazy time
Right.
for me. Yeah. So I ended up getting tremendous support from my parents. We ended up living as a 3-generation household
Oh, wow.
for 20 years, actually.
Oh, wow.
Yeah,
So
they helped.
special though for your kids.
Yeah, they helped me raise my kids. Couldn't have done it without them because my kid's dad didn't stay very involved. But
Mm,
the first 2 years, I worked at a small hospital that was like very close to where we were living at the time, which is not
mhm.
far from where I live now.
Right, right.
And then I joined my practice in 2006. So, and it was private practice. Great practice, great partners, and had a really good thing going for a long time. And then it kind of evolved over time to a point
Mhm.
where our most recent evolution, if you will, was into a private equity situation that did not really go very well, was not what we were maybe expecting it to be. And so for that reason, I actually just left my practice
Wow.
3 months ago. So yeah,
It's
very,
it's a little bit like jumping off of a cliff, isn't it?
it is very
Like,
much like that.
am I where am I gonna land?
It really is because I truly left without really a plan. I'm
Mm,
not the only one who left, and some of the other guys who left, left specifically for other jobs or had other jobs, lined up, left
mhm.
for the same reason that I did.
Right.
But at my stage in my career, there were a lot of things that I knew I didn't want to do moving
Right.
forward. I didn't want to go join a big health system. I didn't want to go join another group. I had kind of the group of my dreams for a long time, and
Mm,
now I'm in a very like I'm kind of in limbo trying to figure out exactly what I want this next chapter to be. So
mhm, mhm.
but yes, it is not really where I expected to be at age 54
Right.
after being in this practice that I did really love for so many years.
Sure.
I thought I would retire from there. I mean, but
Tell me a little bit about what changed when the private equity got involved.
Yeah. So, my practice had gone through a little bit of an evolution before the private equity acquisition. We were, again, a private group that was
Mhm.
5 of us when I joined. We grew it to about 10, and it was a really nice size. But then, right around probably 2011 or so, we then became part of like a super group. So at that point, there was, a lot of in our sort of neighboring county, there were a lot of practices that were coming together and forming this, again, kind of super group, mega group, to try and have like strength in numbers and a little bit
Right.
more power with, negotiation with insurance companies, et cetera.
Sure.
So ultimately, even though we were a, larger private practice, we weren't so huge. And, we
Right.
ended up being approached by them, and we thought it was probably good for our future. So we had already evolved a little bit into that, but that whole larger entity was still a private practice, and we
Right.
still kind of ran our day to day the way we wanted to. So it did give us some benefit and really didn't change our day to day very much. So that was
Right.
good. But then fast forward to about 2019 or so, and the
Mhm.
leadership of that big group is coming to us saying that, like, we've taken the group as far as we can. We were about 75 docs at that point, and they were like, we need to keep growing and be strong in our region, and putting ourselves out for private equity is like the way to do that, so they can help us continue to grow, get bigger, acquire more practices, et cetera,
Sure.
et cetera. So, ultimately, that was a long process in that, all the due diligence back and forth, and then also the pandemic hit, and that kind of put
Mhm.
a little bit of a delay on
Let
things.
me can I ask you one question, though? I'm just a little confused. So the reason to do this
Mhm.
and bring in the private equity for our listeners who might not know,
Yeah.
because
Mhm.
I wasn't in private practice. I worked for an academic institution. So
Yeah.
the reason is you need more money to keep growing. You need
Mhm.
more money for infrastructure. What is usually
Yeah.
the
Yeah. So,
rationale?
I mean, they're right. So the reason generally is that depending on what the status of your practice is, I mean, sometimes people are struggling and they need more capital. Maybe they're a smaller entity and they need more,
Mhm.
capital, money, whatever, to keep kind of
Right.
afloat, to just stay afloat, as opposed to
Right.
growing. And so sometimes that can be, a factor. Or, I mean, we were a large practice that was, doing well, but in order to compete in our marketplace, there's like big health systems around us. We were like the only real, well, there's another big orthopedic practice, but they were probably like twice our size. And so as far as trying to compete and like stay, present, and grow more,
Mhm.
yes, what was needed for that, per our leadership, was, we needed a stronger partner. We needed somebody who was going to come in, who was going to have, be able to bring in, this bigger infrastructure, bring in the money, and bring in investors and all of that, to continue to grow and acquire more practices, and just, get bigger and bigger and
Sure.
bigger, because it seems
So,
like
but
that.
how did that change how you practiced medicine in your practice then?
Yeah.
What
Mhm.
changed?
Right. So for the first year or so, I would say not much changed. But
Mhm.
what happens is, at least with the deal that we did, I mean, they'll come in, there will be, they will promise, to do some, great things, as far as,
Mhm.
we have these, programs, and we have this infrastructure, and we have, all of these wonderful like metrics and things that we follow, and there's so much that we can do to ultimately make you like more productive, and, it's going to be great for you financially ultimately, and we're going to be able to, bring so much more volume into the practice, and then, continue to grow it. So a lot of what they say sounds pretty good right off the bat.
Right.
They have a lot of like things to, really improve the patient experience, and that things are going to be better because they have all these metrics they follow, and so on and so forth. And, we're going to have this huge, EMR, like all of this stuff to draw from, that we can really look at all of our results and outcomes, and we can, just come up with better protocols and policies and all of these types of things too. So, again, they do make it sound very appealing.
Right.
And then what happens is, or at least what happened for us, and again, it may not be
Mhm.
every deal out there, but what
Sure.
happened for us is, they come in, they also are charging very large management fees for all of these things they're going to do for you. So,
Right.
I mean, certainly they have a little bit of an agenda also, as far as, making money for their investors and their shareholders and whatnot. So,
Mhm.
so on that end, they're coming in and also like charging a tremendous amount of money per month for what they're doing. And,
Mhm.
in the first year or so, they really weren't doing anything for us, to be
Right.
honest. I mean, our
Hmm.
first year didn't really look any different, other than we were paying these huge management fees. And so, from a physician standpoint, we were really, kind of being asked to work as hard, if not harder, than we had been working, and try to bring more patients through the practice, and really, maximize the volumes, which is fine to a point, but then we weren't really getting any support for that. So
I heard that story before.
yeah,
That's happening everywhere.
exactly. So, I mean, you get into the next year and beyond, and then that problem only continues to get worse. So now there is a little bit more of a presence. There's some things that are changing, some things that are becoming more centralized, that, including like schedule templates are changing, call centers are changing, and they acquire another group. So 6 months after the acquisition of my practice, there's another group brought in that's close in our region. So now we're up to about a 90 doc practice.
Oh,
And
wow.
they want to like centralize
All orthopedists?
all orthopedists. We had some non-operative like rheumatology, a few
Okay.
rheumatologists, a few physiatrists, but then what they start doing is trying to like centralize things, trying to cut staff, trying to cut costs. Their management fees are still there. It is doing nothing to improve the lives of the physicians or the patients. For example, rheumatology, they said, was not productive enough. So we had 3 rheumatologists, I believe, and they were let go. And you know how, I mean, it is so hard to find an appointment, at least in our region, with
Right.
a rheumatologist, and we had some great people, but they said, they weren't, weren't generating enough revenue. It's not, profitable enough. So,
Well, medical subspecialties are never going to bring in as much revenue as the surgeons, right? I mean, that.
yeah, I mean, right. So, but the non-operative, I mean, the physiatrists
Mhm.
that we have and the rheumatologists and everybody we had, I mean, they're certainly doing their part. Non-operative
Sure.
sports medicine docs. But yeah, from I guess like a procedural standpoint, because some of our non-operative docs can still do some procedures with
Sure.
ultrasound-guided injections or other things
Right.
like that.
Right. 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 Right.
Or but
Ugh,
anyway, I mean, so what happened is it kind of just went from bad to worse, and the
yeah.
day practice, really became increasingly kind of miserable for many of us. And the only answer we were ever given was that you just need to continue to like work harder. We just need more volume. But unfortunately, that everything that was happening was just,
Work harder with less.
was,
Yes.
and
I know that one.
right, the support's not there, and
Mhm.
things that they were like, again, trying to do, would just, were kind of disasters. Like it didn't help anything. It only hurt things. So,
Right. Sure. Ugh.
and it got to a point where, and not only me, but like I was the most senior person who left
Mhm.
so far. I
Mhm.
can't work like this. And, I mean, I was trying to still do my best for my patients, and, patients were noticing the differences, as far as the operations through the practice. I mean, things weren't
Sure.
smooth. They couldn't, this big call center thing they did was just such a disaster, and people couldn't get through, and people weren't getting messages answered. And we were just, handing out our cell phone left and right, and trying to like save
Right.
our practice, and, be there for our patients. But it became unsustainable. I mean, it really did. I mean, it was to a point
Sure.
where, even myself, like I'm single and my kids are grown and out of the house. So at least, but I was working my full, 10-hour, 12-hour day, whatever it would be. And then
Right.
coming home,
Right.
like working more, doing charts. And I don't mind working
Charting.
hard.
Yay, charting.
I know. And at least I don't have like kids here or whatever, but like
Yeah.
we're also allowed to have, some downtime and maybe a life outside of work. And so it was getting to
Sure.
the point where, it was just, so miserable. And then we were being so undervalued and controlled, and not, being able to really have a voice in it anymore. So
So I just have to
yeah,
I just have to emphasize that point for our listeners, because you will hear this variation of this story
mhm,
from most of the people, most of the physicians that I bring on that have come out of either a private practice or an academic center, that this is the way of medicine right now. And so, I talk about the empowered patient, but the fact of the matter is, and one of the reasons I was so excited to have Adrienne on this podcast, is because I want everyone to also understand what's going on the other side.
yeah,
So, although, I try to empower my patients and educate them and teach them
mm,
how to advocate for themselves,
mhm,
I don't think a lot of people know
yeah,
what's going on in healthcare right now. And, everybody hears about the insurance companies and how that's, making practicing medicine so difficult. But
mm,
I mean, as you're pointing out,
mhm,
as things become more, I call it
yeah,
corporatized,
oh,
right? They're
100%.
corporatizing medicine, and we lose autonomy, we lose control, we lose money, we lose the help that we need. I mean, I used to joke, and I have a pen.
Yeah. Mhm. Yep. No, for
So I just, it's so important what you're saying, and I'm really happy to get this out there because I really want people to know what's going on behind the scenes.
Yeah. I
So
mean, we
yeah.
were getting to a point in our offices where, like, I mean, we didn't have, like you were mentioned, can I have a pen? Like, we didn't have money in the budget to, like, have a holiday party for our staff. Like that just, that couldn't
See?
happen. Like, how could that, like, not happen? I mean, we're not doing anything super extravagant. There were times where we were like on credit hold with vendors for supplies that we needed in our office. And we're like, how is this even possible too? Because all of
Really, literally, can I have a pen?
all of this exactly, like, all of this money was still leaving our practice monthly to
Wow.
the private equity companies for, like, the management fees that they were charging, and,
Crazy.
we really weren't seeing any, true benefit from that at all, and it just kinda, like I said, kinda went from bad to worse, and, physicians who had been partners in this and built this practice, over all these years in this community and were,
Mhm.
kind of like, we're a well-known entity in this
Right.
community, and patients were starting to go elsewhere, and
Mhm.
but also many who, like, even like knew us, or I mean, of course, you go to the grocery store, you go to your kid's soccer game, you go wherever, and, like, you
Right.
end up seeing people, and patients were, often like, what's going on with your practice, like, what's
Right?
what's the problem, like, I can't get in, or this and that,
Yep.
and I
Yep.
can't get, nobody's calling me back, and I need to get my MRI, and, whatever it might be. And so we had a huge staff of PAs. We all worked with PAs. And so, again, like, we all just started to, as best we could, like, hand out our cell phones, be available at all hours. And again, like, that's fine. And I don't mind doing that. And I, always, like, would pride myself on, like, trying to be available for my patients and educate my patients and all of that. But
Sure.
there's only so much you can do and only so many
Right.
hours in the day. And then, I mean, we were at a point where, as physician partners in the group, I mean, we were bringing home, like, less than half of what we used to make. And I
That's
don't need,
incredible. And meanwhile, you did it to expand.
right.
It's crazy.
So, I mean, I don't need to be having some extravagant salary, but I need to be able to, like, sustain my life, and
Right,
it
right.
was getting to a point where
So,
that was hard to do.
after all those experiences and now being 3 months out, and I realize it's still fresh,
Yeah.
how do you have an idea? Could you give us an image of how you would if you were to start practicing again, how do you see that? How would you like to see it structured?
I mean, the only way that I would want to practice again is if I was truly in private practice, like truly an independent physician once again.
Mhm.
I mean, and whether it was just by myself or whether it was with, a couple other partners, a couple of other people who have also left the same situation that I just
Sure.
left. I mean, that's the only way that I would be willing, to do it again. I've through, some networking through LinkedIn, especially, I've ended up, meeting some incredible people and some other orthopedic surgeons who
Mhm.
are still managing to do just that. So I think, the corporate entities, be it, the larger health systems or even these private equity firms, want to make us believe that it's impossible to do, as far as surviving as an independent physician now. But,
Right.
I really don't think that's the case. I mean, I don't think it was necessarily easy, but I think there are a lot of resources available, and a lot of people in different areas of healthcare and medicine who really want to see the independent physician, succeed and be
Right.
there again, and that's what the patients. I mean, when I was talking with my patients, which I did very frankly in the last few months before I left,
Mhm.
I was explaining to them also, to your point, of trying to let people, at least in my small world here, like, understand what's going on. And
Right, right,
so many patients were also, they're frustrated. They more from the insurance side, like, they can see when they're, having issues with their pre-authorizations and things getting
right.
denied and so on and so forth. But people were aware to an extent. Some were kind of shocked, others weren't. Others were also talking about, like, I'm losing all my good doctors, like, people were
Yeah.
leaving, and people were like, there was legitimate, like, looks of, like, kind of like despair on people's faces, like, what am I going to do,
Right.
and it was very sad. I mean, it was, eye opening. I mean, again, I realized what's going on, but it was very sad to, like, see people, like, be so, like, worried about, like, how they
Yeah.
were going to get healthcare in the future, and even just orthopedics, which of
Sure.
course, I mean,
Yeah.
what we do is important, but we're not, like, life-saving docs, right? So, like, then people also worrying about, like, their cardiologist or
Right.
their primary care doc or whatever. So
Yeah, you can imagine how I felt. I
that's
mean, and what was very hard also for
yeah.
me personally,
Uh-huh.
sorry to interrupt, is
Oh, no, no.
was the fact that they basically when I left, they basically sent a letter to everybody like, she's leaving. We're going to reassign you somebody else. Like patients who are actually calling my office, my secretary would tell me,
Mhm.
is she okay? What happened? Did she die? Like where is she? What happened to her? And like it was just like cut off. I
Same
don't
thing.
have any access to them. They don't know what happened to me.
Mhm.
I think that's very disconcerting. And these are cancer patients, patients I had potentially been treating for years and years and years,
Mhm.
potentially had been, quote, keeping them alive, or it was horrible. And, I think it's actually funny now. Some of them are finding me on social media. They're
Mhm.
finding me on Instagram, on Facebook.
Mhm.
But none of that came from my employer. They just pretended
Yep.
like I fell off the side of the earth.
Yep. I mean, the same thing, same exact thing happened with
Yeah.
me. And, there was a letter that went out that I was supposed to be able to, like, I mean, I knew there was going to be a letter. And then I had
Right.
said to, like, whoever it was that I was speaking with at the time, I was like, I'd like to be able to, like, write something or see it or whatever.
Sure.
And certainly that never happened. And then I just
Nope.
ended up having like a patient come in with the letter. Like, it was like a husband and wife. I've treated the both of them probably, but I had just
Right.
replaced the husband's shoulder, and they came in for like a follow-up visit, and she had the letter in her purse, and she, like, brought it out. She's like, this is unacceptable. Like, it was just, I mean,
Yeah.
it was just like what you describe. And she's like,
Yeah.
why, like, and I've had plenty of people then, who already had my number from before or whatever, reach out to me. I certainly
Right.
have some patients who find me on social media.
Right.
Yeah, and people are, I mean, they're curious. So people I wasn't able to see, because again, I've been in the community for a
Right.
long time. So
Yep.
those
Same
last
happened.
months that I was there, I was able to, again, have conversations with people. But other than that,
Yeah, no, there are plenty of patients that I would see on a 6-month or annual basis that all of a sudden I was just gone and I hadn't gotten a chance to talk to them beforehand.
yeah.
Let's pivot a little bit though.
Yeah.
I want to talk about
Mhm.
let's talk about some of the fun things that you've
Okay.
been doing. I want to hear a little bit about some of the you were telling me about a
Mhm.
women's group that you have for healthcare workers or something.
Yeah.
Tell us about that. That
Yeah,
was really
sure.
exciting.
Yeah, yeah. So myself and my best friend, whose name is Lisa, started a platform about 5 years ago called The Working Mom,
Mhm.
and we wanted to try to find a way to kind of support other, like, working moms in ultimately in healthcare. At first, we kind
Right.
of just made it more general, but we had been kind of, both of us, thinking about another angle, like something else we could do aside from our clinical work. And
Right.
we both are single moms. So I have two daughters who are now 23 and 25. And she is a daughter who's now 17. And so we also, I had also often gotten the question, like, how did you do it? Like, how did you manage to, be a busy surgeon and raise kids? And
Sure.
of course, my first answer always is I had a lot of help. And I mean, there's certainly
Yeah, sure.
strategies I had and things I did, but, had a
Right.
lot of help specifically from my parents. But just in general, having some support from, friends and other people who, are kind of in the same boat. So then
Right.
we thought, well, we've both done this. We both have had success with it, so to speak. And so, like, and we feel like there's a need, for having some, like, support for other moms to do
Sure.
the same thing. And then we ended up kind of focusing a little bit more on moms in healthcare. So we basically just started a blog, and that was our way to try to, like, get our experience out there. So we have a website and a blog that we would add to periodically, and then started to do, some stuff on social media, mostly on
Mhm.
Instagram, but we're pretty much on all the platforms. And we didn't really know 100%, to be honest, where we were headed with it at the beginning. We both liked to write,
Right.
and we both wanted to kind of get our experience out there. We thought ultimately we could, try to do some retreats or other things, and, try to do some, like, events and that type of thing. We've been
Sure.
to two different, like, women's expos, and we tried to, like, again, just kind of offer our, like, advice and support. And then we
Right.
finally landed on writing a book. So in
Right.
the last year, we figured one of the best ways that we could think of anyway to kind of get all of our information out there would be putting it down in a book. And then
Mhm.
like to write kind of a series of books. And the first one just came out just like a couple months ago. And it is just a short handbook, because we know that all of us working moms in medicine also don't have a lot of time to, necessarily read through, a huge manual about what to do.
Sure. Right.
But it just kind of goes.
Just the cliff notes. We need just the cliff notes.
Yeah, exactly. So it just kind of goes through some of the this first book anyway, kind of goes through some of the things that, we often can struggle with, like obviously some, I need more time, I need more energy, I need more, like, you name it, and we have all the different chapters like about
Right.
these things. And
Sure.
then and my Lisa, my business partner and friend, she's like, she likes to cook, and she has like these little, quick recipes and other things like that. So and then within the book, there are like QR codes found within the book that then lead back to our blog posts and whatnot, so that you can kind of expand
QR code.
thing. QR
Up
code for
there.
the
That's to the book. It's on
bank.
Amazon.
Yes, it sure is. Thank you. Yeah. So it's just been a short time, but we've gotten some really nice feedback. It is something, again, that you can like pick up and like flip through and read, in one
Right.
sitting, and then, potentially refer back to it. But our
Great.
goal is to write a series of them moving forward, kind of chronologically through the phases of raising kids, through as a mom, again, working in healthcare. Although I think a lot of it could be applicable to a mom, a professional mom, like who's busy in
Yeah,
career.
any professional woman, sure.
Yeah, but then ultimately we would like to still possibly do some, retreats or other things. We were looking into how to, like, get CME credit for that type of thing. So we're still building, still developing, like, where we're going to end up.
Sure.
Like, but our goal is to, kind of, again, write this book series. And, I don't know how frequently we'll be able to get a book out, but that's our goal.
That's wonderful. That's really great, and I'm sure this book is gonna help so many women. It
Hope
was certainly a
so.
struggle. Um, Definitely. I mean, we
Yeah.
didn't really talk about this as much, but I have 3 children also, and,
Yeah.
Luke is going to be 27 next month. I can't
Oh,
believe
wow.
that. Is that how's that
I
possible if I'm only 30, right?
know.
So and Tyler is 23, I think,
Yeah.
and yeah, 24,
Yeah.
and my baby is 19 years old, but, there was a time when,
Mhm.
the juggle was
Yeah.
insane. I mean,
Mhm.
spreadsheets up on the wall with, like, color coding of who was gonna pick up who and when and where, and while I'm still at work, and then
Absolutely. Yeah. Oh, absolutely. Yeah. And I think one thing that I've found interesting is now having discussions with my adult children. So, and, the perspective, their perspective on like their childhood and times. Cause I definitely, as we all do, also suffered with that working mom guilt and,
Totally.
certainly being, missing some things. I mean, I had certain strategies and certain like non-negotiables, I'll call them, that I did through, especially as
Right.
a single mom, that I did, especially in their younger years.
Mhm.
But always, I mean, being on call or doing, again, as a surgeon, coming in the middle of the night sometimes, or on the weekends, you certainly couldn't make plans. And there were definitely times where I felt, that the guilt was there no matter what,
Right, right.
missing something. But interestingly now, like talking with them, even once they were in high school or so, but certainly now as adults, their perspective really helps a lot. It really makes me feel better in that there's
Mhm.
mom, like, we didn't really, yes, we might have been upset at the time a little bit if you couldn't be there for something, but like, what we remember now are all the times you were there, like all the times that
Sure.
you took off and volunteered in our class, or that we got to, take a trip together or whatever. Like, those are the things, and they're like, we know, and we're proud of you for like how hard you worked and what you do and all of that. So that's the other thing that I think.
You're a great role model for them
Yeah, I
also,
mean,
right?
we are, right? And
Yeah.
so that's what I think is also, as far as like kind of trying to give back and give, give strategies or give support, and just like, hey, reassurance, like,
Right,
it's okay,
right.
like, because to the younger moms that are coming through, and like
Sure.
certainly understand those feelings that you have, because I had them too.
Yeah.
But if
Yep.
you then can take some, let's say,
Or the stress when you're in the clinic and you've gotta get to the dance recital, the soccer game, the lacrosse game, and it starts at 5 o'clock, and, as you're still in a room with a patient and it's
Mhm.
4:40 and you're like,
Yep.
the
But
terror of how to
absolutely.
do it all, and how to be the best mom and the best doctor and the best employee and the best wife and or the best
Mhm.
whatever, and it's just
Yeah,
exhausting,
for sure.
exhausting.
I always joke, like, my office staff, especially when my kids were young. I mean, we had great staff, and again, these were the years of like the early private practice, which I loved, and
Right.
but still, like, a lot of the women who I worked with, like, they would always describe me as focused. They're like, like, don't mess with her because she's got to get somewhere, like, and I wasn't trying to like not not be nice or whatever. I was just kind of like, I didn't really like have a lot of time to like chit chat with people and whatever. I would spend that time like chit chatting and with my patients. But as far as like staff and whatnot, I was just like, okay, like get this, we need to get this done, get to the next room because I've got to be, out the door at this time.
Well,
And
it's actually, I have to interject. It's actually interesting that you get away with that. You got away with that.
yeah,
Maybe it's because it was a private practice,
yeah,
but
mhm,
in larger centers,
yeah,
um, the women are expected to act and
mm,
be a certain way,
yeah,
and when you're not, you're
yeah,
kind of thought of as a bitch
yeah.
or
Oh,
something
for
like
sure.
that.
Oh,
I
yeah.
mean, there's absolutely a double standard on how men can act and how women have to act in the practice, but
Yeah.
it's
Yeah.
it's interesting.
Yeah. No, no, for sure. And I think the only reason it was that a lot of the women in my practice actually who work there, other support staff had been there for years and, were just like great people and like,
Right.
and like really understood and were moms
Hmm.
themselves and
Right.
whatnot, were maybe like a little bit older. And so they got it. Um,
Right.
certainly some of that went on in the OR though, because again, like I was, the only woman. And like, I also, when I came in and started, like I did some things differently that I had been, that I learned from my fellowship and like I replaced somebody in my group who left and like he did some things differently with the shoulder surgery
Right.
and whatnot. And they're like, that's not the way like we do it. I'm like, but it's the way I do it. And like,
Right.
you know, and that didn't go over so
Last
well.
last I checked, I'm doing the surgery. That's crazy.
So yeah, but anyway, you keep going.
Yeah. So the last thing I wanna make sure that we
Yeah.
get to touch upon is you have, and I'm definitely gonna put in some clips for this,
Okay.
about your dancing.
Yeah.
Tell me about your dancing. That is so phenomenal. I love watching
Yeah.
all the
Aw.
things you've been posting. Tell me
Thank
about it.
you. Yeah, so I started doing competitive ballroom dancing 7 years ago,
Mhm.
and we had just been my family, like the kids and my mom especially, were big fans of watching it. Always, like we were totally hooked on Dancing with the Stars. Watched that show from like literally when it first started. And
Were you on that show?
what's that?
Were you on that show yet?
No, 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 no.
Maybe
Uh,
we'll get you on, maybe we can get you on it. Anybody listening that can
yeah,
help us get her on that?
so but we really enjoyed watching it, and to the point where like we would pick our favorites. We were voting, like we went to some of
Wow.
they go like do their live tours and stuff sometimes after the seasons. We went to a bunch of those, and so
Mhm.
really just always like enjoyed watching it. Was definitely like just a big fan. And then as my kids got older, because again I was single from the time they were 1 and 3, and I stayed single and just really focused on work and them,
Right.
which was great. And I mean that just was the way I wanted it. And then
Mhm.
as they got older in like high school years, and I'm like, okay, college is coming, and my life is going to change, because there's going to be a little bit
Sure.
of void. And so like, what would I like to do with that? I thought, well, I mean, I tossed around some things, but I really would love to learn how to dance. And so I ended up thinking of just taking lessons for like social dancing, like just to learn, and not, I had no idea you could compete and do everything that I do now. So
Mhm.
I just basically in 2018, so my oldest was a senior in high school at the time. I went to a studio that was not far from where I work. And one of my partners and his wife had taken lessons there in the past. And
Mhm.
I knew of it, have driven by it many times. And so basically went just to learn social dancing, and met some people there who like competed and were really serious about it. And I was like, wow, I had no idea that you could do this.
That's
And then,
fun.
yeah,
So
and it's,
what did you like about it? Tell me about, like, how it made you feel or why you liked it so much. Like,
yeah,
what was
I think,
attractive about it?
yeah, I mean, I think it was a lot of things. I mean, just the actual like act itself, like just dancing is fun. I mean, I guess,
Mhm.
not for everybody, but like I really just enjoyed it. Just the basics of it. But then, of course, things have evolved from there. But the dancing, the music, I got very lucky with my teacher. So I got matched up with my teacher who, we do things very differently now than then. We're not with the studio anymore. So
Mhm.
that's kind of changed a lot over time. But we really hit it off. And then it was a challenge. Like it was something new. I was 46 years old when I started. I had never
Uh-huh.
danced in the past.
Right.
So I think it was also like, even though it was a challenge, like it was something that I wanted to try to like, not that I could like you probably can never master it because there's always a next level you can get to. But I
Uh-huh.
was, like, it was something that I just really wanted to, wanted to get better at. Like, I watched people who were like, had been doing it for years, and like see them on the dance floor, like at a competition, and they were,
Mhm.
it was so amazing to watch. And so I made me think I could possibly like be there, be at
Mhm.
that level at some point. And it just, I don't know, I just became like a passion, and it just really kind of took over.
That's
So
amazing, though. What an interesting and fun and
yeah,
wonderful hobby that you picked up
yeah.
now. So, and you won something recently, didn't you? Or
Yeah,
a
I
couple
mean, we
things?
do pretty well in our competitions. I mean, there's different like levels and different age groups and everything. So,
Uh-huh.
and we dance some different styles. So it's a pretty complex world, actually. It was like way more involved than I thought. For your skin, and then like, there's a lot of great people that I've met, and and you just kind of always want more. That's the way I feel about it anyway. But yes, I mean,
Sure.
we compete mostly in Europe now. My teacher is from Italy, and actually lives in Italy now. He was here for a couple years when we first started, but then when
Uh-huh.
COVID came, he went home and then stayed home. So we maintain an independent partnership now because we wanted to keep dancing together. So that's been an added like thing about it. So that's been an added
So now
challenge.
you get to go to Europe.
But
Wow.
yeah, so I travel to Italy about 4 times a year, and we train together because otherwise we train on Zoom, which is
That
interesting.
must be challenging.
Yeah, so we make it work. It's definitely not traditional, but we've made it work, and yeah, and so we go. I go to Italy about 4 times a year, and then
Great.
we train like more intensely for several days in the studio there where he is now,
Mhm.
and then we compete mostly in Europe. Yeah, so I was just there last month, and we did a
That's great.
competition in Portugal.
So
Uh,
you dance with him. Your
yes,
teacher's also your
yes,
gotcha.
with my dance partner. Yes, so that it's
So why don't you move to Italy?
yeah. So
Where in Italy do you go?
it's a small town in Tuscany, so northern Italy. Yeah,
I mean,
yeah, I know.
huh,
It's
I don't
nice.
know. I don't know, Adrian, sounds like a tough call.
Maybe,
Philly,
yeah,
Tuscany, huh,
yeah.
hmm.
Well, I have these. My parents and my kids, and my kids.
Yeah,
Neither one of them live in Pennsylvania right now, but
mhm,
I expect that one will settle in Boston, which is where she went to college, and the other one will probably settle in New York, which is where she went to college. But
sure, okay,
but we'll see. I mean, I certainly would love to get to a point where I'm spending more time, than I currently do in Italy.
sure,
But it's been amazing, and so yes, and it's a very interesting kind of like teamwork then, because your teacher, your coach is then also
right,
your like your teammate, and so yeah, it's pro-am. It's pretty cool. And the other thing about it is there's a lot of people, there's all age groups, and all variations, like I said, of like levels, and so there's a lot
sure,
of people who do this well into their 60s and 70s. So that was the other thing that was very interesting to me, is like something I could continue to do.
mhm,
I feel like I kind of started it late in life, but a lot of people do. I mean, so
right.
it's something that then if hopefully if you have the health and the fitness and whatnot, it's great
So
exercise.
it's not too late at 56 for me to pick this up?
No, no. So I mean, and
I'm
that,
more of like an '80s disco girl.
yeah,
That was my teenage years, '80s and '90s, but
yeah.
that's so
No,
funny.
but it's a lot of fun. And
Mhm.
I mean, there can be some frustration and hard times too, but I definitely I just love it. And
That's
yeah,
great,
I
that's
hope
so
I'll continue
wonderful.
to do it for a long time to come still. So yeah,
Fabulous. Well,
yeah,
you have to send us some of your tapes, and I wanna put some links in our show notes
sure,
of
yeah,
your dancing as
yeah,
such, so
we'll
so
do.
any last words for our audience? You've told us such amazing, interesting things. I mean, she was a lacrosse player, she tore her ACL, she was an orthopod in a male world, then you were in
Yeah,
private practice with large groups, and you were corporatized, and now you are finding
find
a
my
new pathway, which is
way.
amazing.
Yeah. No, I mean, I think that's just the thing. I mean, I feel like, I might be a pretty good example of like, if there's something you want to try it, whether it,
Yeah.
whether it be, doing orthopedics as a woman in the time where, I mean, even
Mhm.
still, but certainly as a time where it wasn't super popular to do,
Right.
picking up a new sport or hobby that's, became pretty intense way to do it, later
Right.
in life. Um, and even just taking this leap, like you said, kind of like I definitely took a leap into the unknown a little bit now.
Mhm.
At this point in my kind of career, making this change. But I do feel like, I was in an unsustainable situation, and I
Sure.
feel like think a lot of us, particularly physicians in medicine, we'll put the blinders on and we'll bury our head in the sand and we'll keep going because that's kind of how we are taught, and that's how we're ingrained to
and that's how we got there in the first place, right?
Exactly. So I think it's, I mean, there's certainly a lot of talk about physician burnout and moral injury and all of this that I think is obviously a very like hot topic right now for good reason. And I think, that there's a way out. There's always a way out. There's something else that you can do. And even if it ends up being that you can still provide value and use your knowledge and skill set in a non-clinical way, that's great, or if you can find, your way back to do something different clinically or do something more, let's say on your own terms, then I think that, you owe it to yourself to at least consider it. Because I really like when I, let's say, got on the other side. So, and like you mentioned, I mean, it's really only been 3 months, but
you're still fresh.
Yeah, what I have found is like, wow, like I can't imagine going back to exactly what I was doing again, not that way. And the other thing I will just put a plug in for the power of LinkedIn, because I'll tell you, like I started telling my story on LinkedIn about a year ago without knowing for sure if I was going to leave my practice or not. The fact that I did opened up so many doors and, so many connections and, and it made me feel a little bit like safer about going ahead and taking
amazing.
that
I
leap.
honestly, I'm so impressed by how many followers you have. I mean, you really struck a chord with a lot of people.
And I was surprised. I mean, I had no, I really didn't know what to expect when I kind of started. I mean, I've been on that platform probably since like 2011 or so, but didn't really use it hardly at all, to be honest. And then when I started, kind of getting serious about it and whatnot, I too was surprised. And I was like,
no, I mean,
I've met some incredible people. I've already had, several like in-person or what they call it, the IRL in real life meetups from LinkedIn. And the beauty of what I would say also, or what I've seen, I would say, is that every single person that I've met in person or someone like yourself, I've done, several podcasts, where I've got to meet kind of like this, virtually and whatnot, has been exactly what I expected. And they, I mean, again, I'm sure there's some people that are less genuine out there, but I just feel like there's a lot of like truly genuine people and they kind of gravitate toward each other, I guess, and so it's been very rewarding for me. And people have been hugely supportive. So that, like I said, it felt like a little less scary to take that leap, that I thought, okay, like I'm going to be okay. I may end up doing something completely different than, when I had been, but that's also okay, so.
Absolutely. Well, listen, Adrienne, this has been such a pleasure.
Oh,
I feel like I know you so well now. I've learned so much about you, and I hope everybody enjoyed this conversation and all that she's been through and is still accomplishing. And I'm so happy about your book. I'm going to put that up one more time with the QR code. It'll take you right to Amazon to buy her book. And anyway, I just am thrilled that you were able to make it today. And thank you so much for giving us your time and all of the insights into your life and all that you've accomplished. So I can't wait to follow you and see what else you're doing. Thank you again.
Oh, it's my pleasure. Thanks for having me. I really appreciate it.
Pleasure. Bye.
Bye.